What's up, good people? Welcome back to my channel. In this video I will discuss basics of esotropia, that what does it mean, and prognosis and treatment and other aspects of that. But still, it's just the basics. If you have more questions, please ask me in the comment section. Okay, I'll try my best to explain that better. So first of all, what is esotropia? It's a form of strabismus. Strabismus means turned eye. It could be right, left, in, out, up, down. That's all strabismus. And then strabismus has its own classifications, and one of the sub classifications of strabismus is esotropia. So an inturned eye is called esotropia, as you can see in this picture. Also, some people commonly call that as a crossed eye. Crossed in eye or a crossed eye is esotropia, as you can see in that picture also. And there are types of esotropia in itself. It could be intermittent esotropia, which means it comes and goes. You have some control on that. So there are times when it's straight, and there are times when it's in one eye or in both eyes, depending. So it comes and goes. Okay, and it could be a constant esotropia also. Sometimes it's infantile or congenital, which means you are born with that kind of turn of your eye. Sometimes it's accommodative esotropia, which means you can fix it with the glasses or contact lenses. It's an accommodative component that's a basic cause of esotropia in that scenario. Whereas at other times it's non-accommodative esotropia, which needs more invasive and more other forms of treatments. Okay, so what are the symptoms? The symptoms are very simple and easy, that yeah, you have some of the problem, in which case the patient says, I have an interned eye. The parents, they bring their kids to me, they tell me that, doc, when he's tired, his eye is turned in. Or the parents tell me, or the patients tell me that I am squinting and blinking to see better. I have a strain in my eyes. I have double vision in my view. What do I do with that? What do I do about that? So it depends on patient to patient, that what is the cause, what is the extent, what is the severity of esotropia, and that determines your symptoms. So the most important thing is get it checked, get it treated. There are so many causes of that. Some of them I have laid down here. It could be genetic, it could be neurological, it could be eye muscle problem, because eyeball is surrounded by muscles that control the mobility of that eyeball. Okay, so these are the muscles, as you can see, around the eyeball. So those muscles determine how straight is your eye, and that's what we fix with the treatment plan of the esotropia. And there are many other medical and neurological causes that determine this esotropia. For example, cerebral palsy, Down syndrome. Okay, how you diagnose? Eye exam. You have to get your eyes checked by an optometrist, by an ophthalmologist, and then go from there. Visual acuity testing and neurological assessment, neuro-ophthalmological assessment is also important in that. Treatment options, there are surgical and non-surgical. My favorite is non-surgical. I go with non-surgical, non-invasive steps first, and if that doesn't work, or if that's not enough or sufficient, then we go for the surgical. The non-surgical options are corrective contact lenses or the glasses. They can help, especially with accommodative esotropia. Vision therapy, a very good treatment for that. And the prisms in the glasses is also extremely useful. I do that all the time. Surgical treatments, it depends, because you have to fix that muscle depending on the amount of damage, and so you adjust the muscle strength and the length and the positioning with that surgery. And the types of surgeries are resection or recession of your muscle, the eyeball muscle itself. And the prognosis, the earlier you diagnose and the earlier you treat, the earlier you intervene, the better the prognosis, the better the results, and the better the follow-up you have with your eye doctor, the better the prognosis is. So it's very important that you address it earlier. That determines your prognosis, and you have to address the emotional aspect of that as well when you are treating that. So it's a treatable condition. First of all, that's very important as a conclusion, and early intervention and comprehensive care is extremely important. Here are some of my references about that, and please ask me questions in the comment section, because again, I went with just the surface, just the basics of esotropia. There's a lot more into that. I'll make more videos depending on your demand, and ask me in the comment section so that I can answer specifically to your tailored problem. Thank you so much. Have a great day.